The Dominican University community is committed to developing in its students intellectual vitality, moral alertness, aesthetic sensibility, and a sense of social justice and responsibility. In recognition of this goal, in 2001, Dominican University commissioned the Bradford O'Neill Medallion for Social Justice, named in honor of Sister Vincent Farah Bradford and Sister Thomas Aquinas O'Neill, two pioneering Cincinnati Dominican sisters. Medallion recipients are local, national, or international figures or organizations whose lives and work have contributed significantly to the creation of a more just and humane world. The 2013 Bradford O'Neill Medallion is presented to Sister Carol Keehan DC. Sister Carol, please come forward. Sue Secker, Rosary College class of 1967, Dominican University trustee and director of mission leadership at Providence Health Services in Mission Hills, California, will read the citation. Sue?
Sister Carol Keehan has been a passionate proponent for the right of all people to have access to health care, regardless of their economic circumstances, ever since she was a nurse at the beginning of her career. Today, as President and Chief Executive Officer of the Catholic Health Association, Sister Carol represents the thousands of Catholic hospitals, nursing homes, surgical centers, and clinics across the country that care for almost 1/6 of all Americans. Her experience as a healthcare practitioner and administrator has given her the credibility to serve as the ultimate authority on Catholic healthcare. Throughout her esteemed career, she has advocated for the poor, the vulnerable, and the marginalized. Born in Providence Hospital in Washington, D.C., a facility that would play a prominent role throughout her life, Sister Carol joined the Daughters of Charity after seeing them in action during her nursing training. She returned to Providence a few decades later to serve as the hospital's vice president. During her 15-year tenure, the hospital opened a 240-bed home, a new operating wing, and neighborhood clinics serving poor families and pregnant women and their infants. Sister Carol took over leadership of the Catholic Health Association in 2005. Following her appointment, she was quoted as saying that while a Catholic hospital has to be concerned with the same things as any other hospital, namely quality and efficiency, it also has to provide care with a commitment to ensuring that all patients are treated with the dignity they deserve as children of God. Sister Carol has used her role with the Catholic Health Association to champion healthcare reform as a moral as well as economic imperative. She exhaustively advocated for the Affordable Care Act as a means of changing the expansive maze that is our healthcare system. And she remains confident that we, as a nation, can create a just and compassionate system that will address the needs of nearly 50 million people who continue to lack any meaningful health insurance coverage. In 2010, Sister Carol was named one of Time magazine's 100 most influential people in the world, and she has consistently appeared in Modern Healthcare's list of 100 most influential people in healthcare. Her numerous awards include the American Hospital Association's Trustee Award, the Pro Ecclesia et Pontifice bestowed by Pope Benedict XVI, the Cardinal Joseph Bernardin Award from Catholic Common Ground Initiative, and the 2009 Vision Award from Catholic Charities United States of America.
In recognition of the many and masterful ways that you and the Catholic Health Association empower people affected by social injustice and economic inequities across the country, always fostering empathy, integrity, accountability, health of body and soul. Through Caritas and Veritas, Dominican University is honored to present to you Sister Carol Keehan with the 2013 Bradford O'Neill Medallion for Social Justice. Please join me in welcoming.
Thank you so much. It is always an interesting time for me when I get introduced and people point out that Time Magazine, 100 one of the 100 most influential people in the world. It does sound kind of classy until you really look close. It's me, Lady Gaga, 2 or 3 dictators. It is not the communion of saints. But anyway, I am truly honored to be here and to receive this medal. Dominican University has a history that is enviable on many fronts: scholarship, social justice, and the arts, to mention only a few. Let me also thank you for choosing to focus this year on healthcare, and especially at this juncture. This is an important moment for our nation. Legitimately, much has been made over the shrinking middle class. And as we emerge from our severe recession, it appears that the top 5% have done well. But middle-class families have lost ground, and those living in poverty have really lost ground. Just last week, the census report was released, showing real median household incomes over the past 5 years have declined 8.3%. It also reported that we have 48 million uninsured in this country. 6.6 million of them are children. Give me any kind of a good excuse for a child not having insurance. When you see the reports that over 50% of personal bankruptcies in our country are due to health expenses, and you see the Institute of Medicine's report that there are 18,000 unnecessary deaths each year because of a lack of medical care, it is clear that we cannot fix this nation's economic problems unless we dramatically improve its health policy. Even more compelling than that is the human suffering and the stress behind these statistics. Think of the parent that has to choose between filling a prescription for his child's asthma and feeding the rest of the children until payday. The terror of parents without insurance when a child has a cancer or heart disease. The tragedy of a young mother who could not seek diagnostic studies for blood in her urine and now has advanced metastatic cancer. Look at the statistics for abortion. Reportedly in the United States, they're down 8% overall, but up 18% in women who are poor. It's not hard to understand why these women feel they have no choice. These examples I give you are not unique exceptions. They are the daily reality in so many families in our nation. They are not from the lazy who want to sponge off society. They are the everyday people who wait on us, grow our food, and often carry more than one job. Let me be clear, I love this country, but it is not the hallmark of a great nation to be the only industrialized country in the world that does not give all its citizens health care. It is not reflective of the genius of this nation to still spend twice per capita what other industrialized nations spend on health care, and yet leave 48 million without insurance, and have health care quality and satisfaction statistics that lag behind the statistics of every other industrialized nation in the world. So I come to you today to say getting health reform right is a great service to this nation and to its economy. We have the ability to lower costs, improve quality, and make a huge dent in the number of uninsured. When you think of what that will mean in the lives of our fellow citizens, it is even more compelling. Catholic social teaching is so clear on this issue. Whether you're looking at Pope John the 23rd, Paul the 6th, John Paul II, Benedict, or now Pope Francis, all have spoken with great clarity on the imperative of health care for all and the injustice of a society that does not provide it. As Catholics, we have a special responsibility to share these teachings and insights with the society we live in. We also have a gospel call to hear the cry of the poor, to let our hearts be so touched that we will not passively accept this any longer. Now, lest this talk resemble an Old Testament prophet raving, let me give you a little good news. We can and we will make a huge difference in the lives of the people of our nation in this coming year. In fact, we've already made a huge difference in the lives of so many people. Since the passage of the Affordable Care Act, or the ACA, seniors have saved over $7 billion in drug expenses, and we are closing that donut hole that was so problematic for them. And millions of them have now been able to get their preventive screenings without any copay. Economists are pointing out to their surprise that healthcare costs are now going up only at the level of general inflation, whereas between 2000 and 2007, they went up 65%. Young adults struggling to find jobs have been able to stay on their parents' plans until they were 26. Millions of Americans with serious chronic conditions have been liberated from the worry of insurance denials for pre-existing conditions and the artificial cap on medical expenses. As I'm sure you know, October the 1st begins open enrollment for the marketplaces or insurance exchanges and the expanded Medicaid program. You have certainly been subjected to incredible amounts of information and misinformation about this. As someone whose middle name sometimes seems to be ACA, let me say this is not a perfect bill. It's not the bill I would have written or the bill anybody else would have written. It is, however, a good start on the journey to a rational, socially just, and economically sound healthcare delivery system. It has the ability to almost completely insure all the women in our country under 65. If completely implemented, it would also provide, if completely implemented, insurance for up to 30 million Americans, 30 million of the 48 who have nothing now. This not only responds to a profound human need, but economically makes great sense for everyone else because it will greatly reduce the cost subsidy businesses and individuals are now bearing when these people have to come and get health care and can't afford it. The law has the potential to help make our healthcare system more just, more respectful, and caring of the dignity of each person. It is, however, no walk in the park. There will be bumps in the road, unintended consequences, frustrations, particularly dealing with states and legislators who are adamant not to give this help to those who need it so much. We must be examples of committed and patient leaders as we work through this major step in our nation to a better, more just, and more loving America. Thank you so much. I'm so honored.
Thank you so much, Sister Carol, for delivering to us on a day that we have earmarked for reflection. Such a beautiful rationale for why we need a health care plan. And thank you also for your advocacy and activism in helping to make it a reality.